We tend to think of high blood pressure and bad sleep as, well, two totally separate problems. But what if they're not? What if they're actually deeply, and I mean dangerously connected? Well, that's exactly what we're going to dive into. We'll uncover this hidden link and see how your sleep might be secretly messing with your heart.
So let me just ask you straight up. Could your sleep be harming your heart? I mean, actively harming it. For millions of people out there, the answer is a huge, resounding yes. And today, we're going to figure out exactly how that happens. All right, so to really get this, we need to look at the two main characters in this story. On one side, we've got high blood pressure, hypertension, and on the other, this really common sleep disorder called sleep apnea. Okay, let's start with high blood pressure. I want you to think about it as more than just a number on a cuff. Picture it like a relentless physical force, like a constant hammering of water against the inside of a pipe. That's what's happening to your arteries, day in and day out. And that's why they call it the silent killer, right? Because you don't feel it, but it's slowly causing damage over time. And here are the numbers we're talking about. It's pretty straightforward. Ideally, you want to be under 120/80. That's the sweet spot. But the minute you start consistently hitting 130 on top or 80 on the bottom, boom, you've officially crossed the line into high blood pressure. And that's the point where all that damage we talked about really starts to add up. Now for the other piece of this puzzle, obstructive sleep apnea, or OSA. And let's be really clear here. This is way, way more than just bad snoring. We're talking about a serious condition where your airway literally collapses while you sleep. The muscles in your throat get so relaxed, they just close up, blocking the air, and you actually stop breathing. So here's what that looks like moment by moment. It's this vicious little cycle. First, your airway collapses. You stop breathing. Then, because you're not getting air, the oxygen in your blood just tanks. Your brain, of course, freaks out. It senses the danger and sends this massive alarm signal that jolts you awake just enough to gasp for air. And the crazy part? This can happen over and over and over again, sometimes hundreds of times a night. Okay, so we've got our two players, the constant pressure from hypertension and the nightly choking from sleep apnea. So what happens when these two things collide, night after night? Well, this is where things get really bad. And here's the fundamental problem, right? Sleep is supposed to be your body's downtime. It's when your heart and blood vessels get a break, a chance to repair. But if you have sleep apnea, forget about it. Sleep turns into this nightly battle. It's a period of incredible stress and strain. There's just no rest at all. Remember that alarm signal we mentioned, the one the brain sends when your oxygen drops? Well, that alarm triggers your body's most primal survival mode. We're talking about the fight or flight response. It's like your body thinks it's being chased by a tiger, and it just floods your system with stress hormones like adrenaline. And get this isn't just a once-a-night thing. That panic button can get pushed hundreds of times in a single night. Just try to imagine that. Putting your body through a life-or-death panic hundreds of times every night when it's supposed to be recharging. It's just brutal. Just look at what 1 hour of this looks like. Every few minutes, there's another apnea event. And with every single one, bam, your blood pressure spikes. It's not a gentle wave, it's a sharp, violent spike. So instead of your body chilling out for the night, it's on this insane roller coaster of stress over and over again. Okay, so you can imagine this nightly battle month after month, year after year, it really takes a toll. And we're not just talking about feeling groggy in the morning. We're talking about real, measurable physical damage to your body. So here's what's supposed to happen. When you sleep, your blood pressure should take a nice little dip, usually about 10 to 20%. It's a natural rest period. But for people with sleep apnea, that dip is gone. Poof! Their blood pressure just stays high all night long. This is a really dangerous pattern that doctors call non-dipping hypertension. And having that non-dipping pattern is no joke. It's incredibly risky. Why? Because it leads to stiffer blood vessels, it creates chronic inflammation throughout your body, and it forces your heart to work overtime all night long. Over time, that can cause the heart muscle to get thick and weak. And all of that, it just skyrockets your risk for the big ones: heart attack, stroke, and even kidney damage. This actually brings us to a really important clue, something that often stumps both doctors and patients. Have you ever heard of resistant hypertension? It's basically high blood pressure that refuses to go down, even when someone's on like 3 or 4 different meds. Well, it turns out that a huge chunk of those stubborn cases have a secret culprit: undiagnosed sleep apnea.
The pills aren't failing. The problem is that you're not treating the real root cause that's firing up every single night. I know. This all sounds pretty scary. But here's the really good news. This is absolutely a cycle that can be broken. We can sever this link between bad sleep and high blood pressure, and we can stop the damage in its tracks.
So the big question is, what's the solution? How do we actually fix this and give our bodies the rest they are desperately crying out for?
And the answer is actually really simple, but it's so important. You have to treat the cause, not just the symptom. The high blood pressure is the symptom. The sleep apnea is the cause. You can pop blood pressure pills all day long, but if you're not fixing what's happening every single night when your head hits the pillow, you're never going to win the fight.
So, what's the game plan? Well, it's pretty clear. Step 1 is getting a real diagnosis, which usually means a sleep study. From there, the main treatment, the gold standard, is something called CPAP therapy. It's basically a machine that provides gentle air pressure to keep your airway open all night. No more collapses, no more oxygen drops, no more fight or flight spikes. Your body can finally rest. And of course, things like weight loss and exercise can also play a huge role.
So let's end with this. If you, or maybe someone you love, is struggling with blood pressure that just won't cooperate, maybe it's time to think about something other than the usual suspects like diet or pills. You have to ask yourself, is my blood pressure trying to tell me something? Is it sending out a warning signal about what's really happening when I'm asleep?